of Supervision for Autism Services. Today, inshallah, we will provide you with the top tip of how to be an effective supervisor when working in autism services in the UAE. At the beginning, we would like to introduce myself and the panelists. I am Maryam Khamis Saeed, and I'm currently a student of Master of Education in Applied Behavior Analysis in Emirates College for Advanced Education, as well as working in the Ministry of Education in Counseling and Wellbeing Directorate. I would like to introduce our panelists. We have today Dr. Nicholas Orland. He has a PhD in behavior analysis. He is a board certified behavior analyst and the autism program head at Dubai Autism Center. We would like also to introduce Ms. Nicole Campbell. She has Master of Science. She is also BCBA. She is a behavior analyst at Amana Healthcare and Zayed Higher Organization Al Mudeef Center. We have also Ms. Linda Bailey. She has a Master of Science in Applied Behavior Analysis. She is the Graduate Studies Assistant Director at Mohammed bin Rashid Center for Special Education, operated by the New England Center for Children in Abu Dhabi. We have also Ms. Cherine Basfar. She has Master of Science. She is BCBA and the Program Director of Carbone Clinic. As well as we have Ms. Manal Alaryani. She is a BCBA and she is the founder of Little Helpers Nursery. And we have as well Ms. Nipa Bhuptani. She has Master of Education in Special Education. She is BCABA and she is the founder and director of Applied and Behavioral Training Institute, ABTi. Before we move to the our discussion, I will just would like to note a few things, that this session will be recorded, but only the video, not the chat. So please feel free to write your questions or chat freely using the chat feature. Please, when you will ask your question, indicate who would you like to answer your question. So we will keep it until the end. The BACB code will be shared during the session. And please make a note of that code and don't type it in the chat. You can write it in your paper or in your phone, but don't type it in the chat, please. And the link to get CEU will be shared at the end, as well as the evaluation survey. Just a gentle reminder, please make sure that your microphone and your video or camera is turned off. So let me stop sharing. Okay. Yeah. Moving to starting the discussion. So my first question is about supervising within a clinic or center. Cherine, would you like to tell us about the environment in which you work, your role as a supervisor, and any potential challenges you might face?
Sure. Thank you, Maryam. Hi, everyone. My name is Cherine Basfar. I've been a board-certified behavior analyst since 2009. I began my career in Saudi Arabia. I worked at the Jeddah Institute for Speech and Hearing, where we established the first clinic of ABA. I moved to Dubai in 2014, where I joined Dr. Carbone and the team as a supervisor. I'm currently the program director at the Carbone Clinic, and I'll talk a little bit about the Carbone Clinic. It's a center providing treatment for individuals diagnosed with autism and developmental disabilities based on the principles of applied behavior analysis, with a focus on BF Skinner's analysis of verbal behavior. We work with learners ages 2 to 18 years old, and we focus on teaching a lot of skills in regards to communication skills, language skills, social skills, play skills, and independent skills. Working, of course, on academic skills like through the use of direct instruction. We serve families in the enrollment who get enrolled in the clinic in Dubai, but also we have our outreach consultancy program where we work with families in schools or from out of the UAE. In my position as the program director, I oversee the BCBAs and senior staff in regards to working closely with the program director assistant, the outreach consultant, and supervisors. I work specifically closely with the program director assistant in training BCBAs on using behavioral skills training in order to develop their supervisory repertoire. We run competencies to assess their skills, and I run a lot of IUAs, oversee their abilities to conduct different kinds of assessments, and provide the different kinds of recommendations based on the learners, discuss and review the literature on a regular basis. We maintain high standards of services by having a high ratio of BCBAs and supervisors that we work with closely in the clinic. I work closely also with Dr. Carbone, where I have regular meetings with him. We look and see the performance indicators, looking at rate of acquisitions and staff performance. Dr. Carbone believes and always discusses in regards to becoming a board certified behavior analyst is similar to going through your medical residency. So in the line with that, a lot of our instructors who are BCBAs work through their last period working on honing their analytical skills and supervisory skills by gaining more experience with working with different learners. I'll give you an example what that means. So a new BCBA or a new supervisor will supervise a certain small caseload where they are competent and have the experience in supervising those learners, but in the same time work with different learners, let's say advanced learners, to gain more competence and gain more experience in working with other learners, other profiles, if you will. And the more they become proficient and they become stronger and they get evaluated and move to full supervisory caseload. I think in regards to challenges that occurred during, especially with COVID-19 and all what has been occurring in the past year and this year, I would say moving to in a very short period, we had to, as a lot of clinics, I think, make the decision to move from a highly supervised model within the clinic setting where we supervise and, supervisors will have 8 BCBAs in the clinic where they can jump in and support their staff and therapists at any moment to a more, if you will, remotely kind of supervision and training, working closely with the supervisors and senior team and therapists, getting everybody ready and equipped to start online supervision and online training and providing services online. I think our staff were able to quickly get all the strategies and tools and trainings in place, and we're able to perform and provide. We currently provide a lot of home services due to COVID and supervision online. I think my tips to young BCBAs and new BCBAs coming in is, in your beginning of your career, try to work with a limited number and gain more experience and competence and build on that, being precise in your work and gaining that experience, utilizing BST and behavior skills training and modeling for your supervisees constantly, seeking mentorship. If you can, seek mentorship in regards to looking for a BCBA that has experience and can help you in developing your repertoire outside of the scope of competence that you already have. That will help a lot. And to consistently, of course, read the literature in the field. As Dr. Carbone always advised, read B.F. Skinner's analysis of verbal behavior and B.F. Skinner's work, read Dr. Jack Michael's work, and a lot of the literature that's published, of course, in the field. And yeah, I think I would I would summarize a bit of some of the tips.
Thank you so much, Cherine. And moving to Linda, would you like to share your experience? I know that you are also in charge of supervising students who are wishing to become BCB certificates. What types of barriers do you face in this role, Linda?
Thank you. Hi, everyone. I am the Assistant Director of Graduate Studies at MRC and ECC. And as Maryam said, my primary role in the center has been to oversee our staff at the center who are enrolled in different programs, whether it's a graduate program, they're interning from an undergraduate program, or they're doing postmaster certificate programs. The majority of our staff are in either a special education or ABA masters. So of course, all of those staff who are in an ABA program will need that BCBA supervision. So a big portion of my role is to not only become as fluent as I can with all of the changes that the board makes, to make sure everyone's getting the type of supervision and experience they need, but to also assign our staff to a BCBA supervisor. So, you know, within our center, I think we're very lucky to have such a large team of BCBAs available for supervision. We have more than 60 on site, and we have around 30 staff currently receiving supervision. So there is a huge variety that our staff can choose from when it comes to finding a supervisor that they want to gain some experience from. But I think that from a supervisor's perspective, that can be kind of challenging because you are able to work with so many staff. You kind of have to get to know them very quickly and to identify where they're at in their supervisory and experience journey. So, you know, trying to identify how can I quickly know, you know, not only do you want to be able to do functional analyses and write behavior programs and learn how to, you know, go through all of the aspects of the task list, how much of it do you already know and what can I do to help you grow in the areas that you want to grow in? So that can be a bit of a challenge, but you know, we also have a lot of new supervisors. I was doing a check this week, and 12 of our more than 60 supervisors were certified before 2016. So we do have a large group of newer certificants. And of course, with the new BACB rules, a lot of them aren't able to supervise independently yet, but you know, just kind of helping try to guide those new supervisors into learning how, you know, not only to be a good supervisor, but how to learn from all of their new supervisees or trainees. You know, another aspect of our company at MRC NEC, it's a very multicultural company, which we are very proud of. We have more than 40, I think, nationalities represented in the company itself, but more than 20 just within our BCBAs. So, you know, I think this move towards being more culturally diverse and the cultural humility that is, you know, being talked about a lot more is something that we're also trying to incorporate with our staff and, you know, supervisors and trainees both. And it does provide a bit of a challenge when it comes to working with so many different people and, you know, just identifying like, how do you learn and how do you take feedback? You know, if you're 5 minutes late for a meeting, is that something that I should be very strict on giving you feedback for? So just learning how to work with so many people and knowing that you as a supervisor can't have like a set script of how your supervision should be occurring. So it's just kind of that growing, constant learning process.
Yeah, it's great, and I see that we are all shocked that you have 14 nationalities in your center. This is amazing. Thank you so much, Linda. Now, let's talk about collaboration amongst different professionals and move to our panelists who supervise multidisciplinary teams. Can we start with you, Dr. Nicholas? Could you please provide us or share your experience as well as any challenges you might face in this role?
Absolutely. So my name is Nicholas Orland. I have a doctorate in applied behavioral analysis. I'm an adjunct professor at the Florida Institute of Technology and Pepperdine University, where I teach master level courses in applied behavioral analysis. And I'm currently the autism program head at Dubai Autism Center. And what's really unique about this capacity is that I supervise a staff of professionals that include RBTs, BCBAs, BCABAs, but I also supervise physical therapists, occupational therapists, and speech language pathologists. And as we have about 120 students, it's really important that the clinical staff all work together for the benefit of the students. So the question really is, how do we do that? How do we create collaborative conditions in which our staff can work effectively? One strategy that we ultimately use is ensuring that communication of long-term outcomes amongst disciplines is consistent. So what does a better quality of life look like for a learner? So once we have agreement on that goal, we then move forward with focusing on what we can specifically do within the discipline that the individual is working in. And communication is going to be a big part of that. So what we actually do at Dhabi Autism Center is that we have meetings to consistently update each other on a bi-weekly basis on the progress of the students, and their goals are ultimately going to be discussed and focused within those meetings. It's really critical to have those meetings. One mistake that I did make was that I was not consistent with these meetings, and when I wasn't, we had some challenges. So it's a good learning opportunity for me, and now we're a bit more consistent with them. But being consistent with them are going to be critical, because really the question you want to ask is, do you want to say that you're a collaborative environment, or do you actually want to be a collaborative environment? Being consistent with those policies and procedures are going to be really consistent. Also creating opportunities to develop reports, goals under conditions in which all the team members can work together. It's also going to be really important. We focus a lot on pre-IEP meetings where all the disciplines get together, discuss our goals, and that usually produces some really good outcomes. So we talked about agreement of long-term goals. I also think agreement on short-term goals are also going to be important as far as the collaboration process goes, in terms of when we're looking at manding, for example, requesting. The BCBA might focus on a one-word mand, whereas a speech-language pathologist might focus on a one-sentence mand. Having disagreement on those goals are going to produce some challenging outcomes. So just creating conditions where that communication can take place will really facilitate some good outcomes, and it has for us as well. Another area that we tend to focus on at Dhabi Autism Center is minimizing behavioral jargon within disciplines. There's a wonderful ABA journal, the Behavioral Analysis in Practice. If anyone's not aware of it, check it out because it is awesome. It published 2 studies by Dr. Timothy Critchfield on the use of behavioral jargon utilized with non-experts and the challenges which are created in terms of the lack of understanding of procedures and the science of applied behavioral analysis. And I was actually finding that at our center, we're having some big challenges with that. A lot of our paraprofessionals and individuals in different disciplines were not understanding what we're doing through the use of our behavioral jargon, more specifically through the use of my behavioral jargon. So we really made an effort as an organization to minimize its use, both vocally and writtenly, and use more layman's terms when interacting with different disciplines. And it's really been critical with establishing relationships with outside collaborators, with our occupational therapists, speech language pathologists, and physical therapists. And they better understand what we're doing. So really just focusing on creating those conditions in which those things can occur. But that's what we've been doing at Dhabi Autism Center. So far, it's been producing some pretty good outcomes.
Perfect. Thank you so much, Dr. Nicholas. Nicole, I believe that you also work with different professionals. Would you like to share your experience?
Yes. My name is Nicole Campbell. I am currently the behaviour analyst at Amana Healthcare, Mudeef Centre within Saeed HO. It is an 80-bed residential setting. So there was therapists before us, so there was different professionals, but we are the first behavioural department. So as the first behaviour analyst going in, it was quite challenging because nobody knew who we were, what we did, what ABA was. So we basically started from scratch, but it's an amazing project to be part of. And one of the unique things as well, we have residents aged from 15 up to 80. So we've quite a great range for age. So for us coming in, so we have currently, I supervise RBTs and supervisees pursuing their BCBA supervision as well. So one of the biggest challenges for us is because it's a 24/7 residential setting, the plans that we wanted to implement, we wanted that to generalize when we weren't there, because we obviously weren't there 24/7. And the biggest professionals was the nursing staff. So obviously the nurses are there 24/7. And bearing in mind, kind of similar to like when you get a brand new therapist, they don't have any experience. So you're starting from scratch. It's almost like basic ABA training. And obviously, when you think about from a behavior point of view, we wanted to pair with the nurses. We wanted to be their allies because we want them to implement our plans going forward when we're not there. So currently the residential setting is split up into 4 villas. and we have quite a big presence on one of the villas because we do a lot of the functional behaviour analysis on this particular villa. So we try to have at least 1 to 2 staff there all the time, so that we are not just saying, here's our plans, go and do them. We are there all the time. We use the behaviour skills training model, and we do a lot of videos, so a lot of video modelling. So if we're not there on site, they do have like a bank of videos that the nursing staff can watch. And we've done a lot of training. We've recorded a lot of training. So that there's constant updates, and kind of similar to what Nicholas was talking about, there's regular meetings. So within a month, each resident is discussed in great detail. And again, it's not just with the nursing staff, it's discussed with the occupational therapist, it's discussed with the speech and language pathologist, it's discussed with the physiotherapist. So again, we're coming together as a multidisciplinary team. Okay, what are our concerns? What does this resident need from all different professionals, and what can we do going forward? What can we work on together, and what can we work on individually? And I think that was one of the important things for us to establish. And bearing in mind the age range of our residents, they've had like 30 odd years of experience of basically where maladaptive behaviour has got me what I wanted, and now you're coming in and you're changing things. So we do see a lot of extinction bursts. So obviously for us, from a behavioural point of view, we're like, the behaviour has to get worse before it gets better. But trying to explain that to non-ABA professionals, it's quite difficult. So you have to be that kind of support mechanism for them going forward as well. And one of the things, when you look at obviously from our FBA model, yes, you have to focus on the antecedent manipulations. Yes, you have to focus on the consequences. But one of the biggest things for us was our residents basically couldn't communicate. So a lot of non-verbal residents couldn't communicate. And myself with our supervisees took on a project where we did like PECS workshops. So being PECS trained, I was able to train the supervisees. And again, we just used the BST model. And we did PECS workshops in small groups because we wanted it to be interactive. We didn't want to be just, here's our videos, go and do it. So we used the, let me show you what I want you to do, let's practice it, and let me give you positive and negative feedback, because that's important as well. And to the point where nursing staff were implementing PECS and actually taking data, which is something that we just wanted them to implement PECS. We didn't worry about the data, but no, we got better. So, and again, I think it's just, trying to always, for me, trying to take a step back, that these are not ABA professionals. You have to give them that extra support when it's needed. And because obviously, like a lot of our residents, some of them are orphans, so they don't have the family contact. And those that did have the family contact, obviously COVID came along and everything changed. And even when we started, we came in and we were wearing masks. It was very difficult for our residents for the transition. But I think working together in the multidisciplinary team, it really helped us. And one of the tips, especially for managing behaviour, that we find useful was debriefs, talking about the incidents. Okay, what happened? What went right? What went wrong? Because again, not everything is perfect. It's okay to say, this didn't work this time, but hey, what can we do going forward? And I think that's just important to keep up the communication channels, the way we teach our residents the appropriate functional communication for going forward. So I find that's worked really well with us. And I'm excited to see what we're going to achieve going forward.
Yeah, inshallah. Thank you so much, Nicole. Thank you. I would like just to thank you for sharing this experience in a residential setting with individuals across the lifespan. How about supervision within an early years environment, Manal? Would you like to share your experience in this setting and any potential challenges you might face?
Thank you, Maryam. Hi, everyone. My name is Manal Alaryani. I'm an Emirati BCBA, and I'm the nursery director of Little Helpers Nursery. In Little Helpers Nursery, we are accepting children, typical children from 45 days till 4 years. And we are also accepting children with autism. We are trying to provide them with the support they need. We are providing an academy and a support area where they're getting their one-to-one, and we are including them also with the children, with the typical children. The reason and the vision for the nursery is to give a chance for children with autism to have a chance to be included with their peers and to have an access for an enriched environment. The vision for the nursery is to give a chance also for the typical children to support and be a little helpers for children with autism. Children, typical children, they're getting a lot of chances to build the skills and to learn morals from being with their peers from children with autism in the same setting. Before COVID, we had shadow teachers in the support area, giving children with autism at least 2 hours daily and include them in the typical classroom the rest of the day. The challenges I faced that some of the shadow teachers who's coming to us, they have no background with ABA, so we have to teach them the fundamentals from scratch, being with them, closing to them, helping them dealing with the student, especially that we are following the British curriculum. And the British curriculum is focusing on the developmental milestone for children. So we are moving from area to area to different 12 areas around the nursery. Not spending more than 30 minutes in that area. So transitioning children with autism from area to area to an interested, like activities to non-interested, scheduling their schedule, daily schedule depends on their interest. It was a challenge because you need to sit with the, the shadow teacher, get the information from her, from the teacher, classroom teacher, the TAs and a TA in that classroom. It's a lot of communication and collaborating between me as a nursery director with the rest of the team. And at the end, we're getting the best scenario for that child to get the one-to-one and get the access to the environment, having, exposure to social skills, playing skills, communication, dealing with the parents, see their concerns, before the nursery, after they're getting the therapy, how it look like at home, in the community. All these things need a lot of collaboration between us and the family. The nice thing that in every classroom, we have maximum of 1 to 2 students with the other typical children. And you will see that we found 1 or 2 students who's really smart enough to be close to our, child with autism. Be curious, ask questions, try to avoid, try to offer them the help they need. Some of them even they can recognize their preferences and they try to accommodate them during their activities. Here where you feel the joy of, being involved in such rich environment where you have really children with autism beside, their peers in a full inclusion setting. Yes, there are some situations they're tough. Some situations are hard, especially after COVID. We put the support area on hold. So we were including the children and we were trying to support teachers and assistant teachers, and we have extra staff to fulfill their needs during hard time. And some parents will provide some, helpers from home so we can train them and they can help at home too. So arranging all of this is really need a lot of effort from supervisor, and be realistic that we cannot be in the ideal model all the time. A support area with all the supervision and being there most of the time, it was amazing. But after COVID and with dealing with bigger number of supervisee, we learned that that the real situation is not that ideal, but still we can help out. Still we can change people's life. In the beginning, after we reopen, after COVID time, a lot of behaviors we saw, less support than usual. It was chaotic in the beginning and it was stressful for me as a nursery director. I want everything to be the best, giving them our maximum support. I want to see them happy, being around the nursery with least behavior. But I learned that we need to take it one step at a time. Raise awareness as much as you can between staff, between families, between nursery staff, even not the clinical staff. Try your best, to focus on the main objectives that you're putting for that case. I mean, the most important goals. And it will come with time. It will come with time, step by step, by collaborating, by understanding, by being realistic to the objective you're putting within the setting, within, depends on the case, it will come up and you will see that picture that you're aiming for.
Yeah, it is great. I like the idea that those children should be included with their with the society. What happens in that nursery will happen definitely outside that nursery. Thank you so much, Manal. It was really such a great experience. Nipa, I understand that you also work in an early year settings, so we would love to hear your experience about this.
Thank you, Maryam. And firstly, I just want to say thank you to this panel. I'm sitting amongst giants here. Like, you know, we have M.Sc, NECC, we have the Autism Center, we have the Carbone Clinic, and Amana, and you know, and Maryam, the and Emirati BCBA. So this just makes me so proud of being here in this panel, you know, which I couldn't have imagined 15 years ago when the autism and ABA journey started in UAE. So I think a big congratulations goes to the entire community for doing this and bringing it here, to the leadership of UAE and to everybody who's put in their you know, their work in this. So congratulations all, and I feel very you know, I'm only a tiny speck here, but I'm so glad that I am here amongst all of you. So that's the start. About me, my name is Nipa Bhuptani. I'm a board certified assistant behavior analyst. And of course, you're wondering why I'm here on the supervision panel. We'll get to that in a minute. I am the founder and director for Applied and Behavior Training Institute, which was formed in 2016. Prior to that, in 2009 or 11, I am missing the date, I founded the Autism Support Network in Abu Dhabi, which was a free platform for parents and professionals to come together and support each other, because there was nothing like that at that point of time. And I was working with the autism population and families and saw the need for that. So that's where it all started. As my role in Applied and Behavioral Training Institute as the director, it is kind of my role to provide the vision for the company, for what we do, and as part of that vision, I want to see that good supervision is provided so that we build capacity, which is going to be serving the families and children with autism here. So I'm kind of on this panel from that perspective, and also as a BCABA, I received supervision from a senior BCBA in the States. And so that experience is something also that I would like to share here on this panel. So talking about the work that we do, Applied and Behavioral Training Institute is involved in the Autism Support Network is still under us, so we do that as our CSR. And we have two other pillars. One is the Training Institute part of it, where we provide ABA-based trainings as professional development for anyone who wants to learn a little more about ABA. That's kind of our dissemination of ABA, moving to other specialities or people who are looking to begin their career in this, or just interested in knowing what behavior analysis is. And a large part of our training clients are also parents. So parents take this training as their basic understanding in ABA, and we're very proud to see the results of that too. So that's one part of the work that we do. And the third part then is the early intervention. And I'm so glad that Manal talked about inclusion, and I love the model that she has, because that's exactly the model we have. The only difference being we don't own a nursery. So when COVID happened, we got kicked out because we are service providers, so we cannot be inside a setting at this point of time. So so we're not into nurseries right now, but we are providing services in homes only for now. So our model is based on the competent learner model, which has its own online training component and a phase-wise implementation, which every phase has its own KPIs. Like you have to be able to meet certain expectations per phase. And within that is the staff training model involved, where supervision is required. So we have, if the staff member is taking the RBT requirements, then that's part of this training. where we provide the supervision for the training, and then post-RBT supervision continues. And then we also have staff members who are taking the BACB course sequences externally, or the CLM BACB course sequence, and we provide them supervision for that with the BCBAs that are in our company are providing that. My role over there is kind of overall vision and making sure the task list is met, like, everything that is being done is done ethically, done correctly. But larger to that, I see my role as staying with the values that we stand for. And our values are compassion and empowerment. So we want to make sure that our staff, our learners, and the families that we work with are treated with compassion. And so we're teaching, we're making sure that in all our interactions with all these three stakeholders are done with compassion. We continue to have our trainings that are very, very much focused towards all learning behaviors and engaging in actions that are compassionate towards each other and towards families. We want to continue to extend these to the community as a whole, like seeing everybody as with compassion. And the previous session that we had just now where parents were participating was resonating so much with the kind of work that we do. So that's our supervision model is very much geared towards teaching compassion and acting with compassion also. The second thing then is empowerment. So we make sure our learners, the little ones, are empowered, and our staff members are empowered with more knowledge and with more skills, and the families that we work with are empowered with better understanding and better action, so that when children go home or when we're working in homes, we are only there for a couple of hours in a week, and parents need to be able to continue doing what we hoping that the children will do. So that's our zoomed out view of supervision is more about building skills for everybody that's involved, applying our behavioral principles not only for our learners, but applying them across our lifespan, across everybody that we come into contact with. And so we're always looking at how does behavior analysis work for each one of us, and how are we shaping each other's behaviors? How are we presenting our environment or preparing our environment for certain behaviors to occur? So that's kind of our supervision model, and we try and keep coming back to it. The challenges, of course, COVID has been a big challenge. Like I said, we've lost learners, but on the positive side, we went into homes and a whole new world has opened up for us. Our staff had to learn so much more because, working in a nursery, of course, it was multicultural and we had all the experiences, but it was our domain. It was under our control, and now we were in homes, and that's not the same, right? We don't have control over what goes on over there, but our eyes open to so much more. As what the child needs and what the home needs and what the family needs. So our focus changed a lot from that perspective. So I think it's been quite a learning experience and a journey, and we continue to do our best.
Yeah, thank you so much, Nipa. It was really such a great model you used. Thank you so much. Yeah. Coming back here now, so as we all experience this pandemic together, how has your supervision changed, and do you have any advice for our audience about how to maintain high standards of supervision during COVID-19? Maybe Cherine, would you like to share an advice to our audience?
Sure, thank you, Maryam. I guess mainly would be maintaining quality. To maintain quality is by supporting BCBAs either through meetings weekly, overseeing their sessions via Zoom. So, for example, the program director assistant will zoom in on supervisors' meetings with their instructors, observe their sessions, and then meet individually with this BCBA and provide feedback. And then I usually have periodical meetings and weekly meetings with the supervisors and with the program director assistant to review performance and performance indicators, monitoring rate of acquisitions of the learners on a weekly basis, looking at staff performance, competency results across BCBAs and therapists. Is very important during this period, and having it monitored, scheduled, to be able to review and provide feedback.
I was just going to add on to that. I think those are really great suggestions. For us too, you know, we used a lot of those similar suggestions. I think the challenge with us was that we're a school environment. So we had 120 students with 40 teachers, 5 speech therapists, 4 occupational therapists, and 4 physical therapists that had to implement services on an online platform, who, by the way, had never done it before, and we didn't have much guidance from the literature. So it threw us a huge curveball, and we had less than 2 weeks to do all of this. So some of the suggestions that we utilized were creating consistent competencies for online instruction. So identifying what does good online instruction look like, create competencies, and then provide feedback to our therapist on those competencies. I think we talked about behavior skills training before. That's also something that we utilize, has a lot of empirical support that definitely assisted us with that. Ensuring contact with supervisees to ensure they have everything they need to be successful. You know, this was a new platform of providing services under really unideal conditions. A lot of people in Dubai were leaving. A lot of individuals were not sure if they're going to have jobs. And now, by the way, we have to do this completely new thing online. So it was really challenging. So just making sure that we had support systems in place for our staff, weekly check-ins, and just ensuring that there was a consistency of that. And lastly, we developed a reinforcement system for our staff. What we would do is at the end of each day, we do a daily check-in just to talk about the successes and the wins. We wanted to make sure that we could support our staff during this process because it was really challenging. It wasn't just that we were doing services online, it's that we're doing services online from our home environments. And that's a whole nother curveball thrown at us. But we tried utilizing those things, and overall, it produced some pretty good outcomes.
Perfect. Thank you, Dr. Nicholas, and thank you, Cherine, for this advice. Do you have, like, going back to Nipa, do you have any advice for supervisors in the audience? I understand that you are a recipient of remote supervision yourself. Could you tell us about how to get the most out of this?
Sure, Maryam. I have kind of a unique story because I started my supervision journey when I was studying, doing my coursework for BCABA in 2006. And that point of time, there was not a single behavior analyst in UAE or around. So everything was remote, right? And so I still continue receiving remote supervision from my original supervisor. The challenges in remote supervision are huge, of course, because, you know, the person is not here, and I used to have to record things and send them over, but it wasn't even live. You know, I couldn't set up a Zoom. There was nothing like that. So it was very interesting. And so from that, kind of, I had to get everything I could in those 5% hours of supervision I could. So I had to devise a plan. And one of the things that I have learned from that, and my supervisor was excellent in teaching me that, is like, every time I went to her with a question or with a doubt, and she only pointed me in the direction of where I could find an answer. She never gave me an answer. And I'd say to supervisors in the audience here is that's a good supervisor. So if you're choosing a supervisor, don't look for somebody who will make your job easier or who'll just give you all the answers, because they are not your teachers. They are your mentors. They are your supervisors. They are teaching you the bigger skills, like the skills that you will need when you are without them. Right? They're like your parent. They're not going to solve every problem. They are going to put you in the direction where you need to go. So think about that when you're looking for supervision. I think that's really, really important. And secondly, seek out. I know that BCBA has this task list, but there are so many things that are not in the task list that you will need as a behavior analyst, and nobody teaches it. It's not in your coursework. It's not in your task list. You're not thinking about it. But when you're out there, then you're going to need it. And it's mainly like people skills, management skills, organizational skills, all these things. ask your supervisor to kind of give you some tools with that, with your leadership skills, with your collaborative skills. All these soft skills, as they call them, are really important, and seek supervision for that. Seek out a supervisor who will give you all of those things too.
Thank you so much. Thank you so much, Nipa. Linda, what advice do you have for the students in our audience today as they receive supervision?
Honestly, my advice would be to listen to everything Nipa just said. I think, taking ownership of your supervisory experience is so important. Even if you're brand new to the company, the field, wherever you're getting your experience from, don't feel like you have to just receive what's given to you. Take initiative, not only in paperwork and scheduling and follow-up, seeking out feedback, but just know that this is your experience. You're probably paying someone or receiving some system like of payment for that supervisory experience. And I like to tell all of my own trainees or supervisees that I'm there for them. I have a contractual obligation with that contract that we signed to do what I can to make sure that they're the best. So they need to just tell me what I can do better and how, I can make sure they're getting what they need. And if I can't do it, maybe I can help find someone that can.
Perfect. Thank you so much, Linda. Nipa.
I'm sorry. I just wanted to add one more thing to what Linda said. Sure. Is also like if you're assigned a supervisor, or if you're starting to get supervision at your own expense. One thing that I would say is like you don't have to. I don't mean this in a bad way, but you don't have to stay with the same supervisor throughout your supervision experience. Go try different supervisors, because they all have different things to offer, and there's different styles, and you will gain from that. So get a variety of supervision experiences, not only the supervisor, but also your field work. If you have the option to work in different settings and different places and different age groups, like Cherine was saying earlier, I think that's really important to get that. Right? So try and get whatever you can, and not only autism, get out there, do more.
Thank you so much, Nipa. Yeah, it's really great advice, as many people, when they are comfortable with a supervisor or a specific team, they don't want to change it. Thank you so much, Nipa. Thank you all to our panelists. Now just let's open it for the questions. So if you have any questions.
Sorry, Maryam, yeah. Manal just had her hand up. So Manal wanted to say something.
Sure.
I want just to add a short step to the supervisors. I think we learned after pandemic time that the power for the students are their parents. So I would really encourage supervisors to empower parents. When it happened, when they closed school, when they closed centers, when shadow teachers couldn't visit my daughter in the home, I was the one who's doing everything for her. Empower your parents as much as you can, because they are the main source to train new shadow teachers, choose the good school, communicate with supervisors, train even the people in the extended family, explain things in the community during, troubles everywhere. Parents are the source for, to empower, the community for that case. So this is something really we learned after COVID, that the parents are the strength for their kids.
Exactly, Manal. Thank you so much. You mentioned really a great point, and when the pandemic comes, as you said, their role appears much better or much clearer in this pandemic. Thank you so much, Manal. So while the audience, so for the audience now, we will open the field to ask questions. So please, if you have any question, type it down and indicate who would you like to answer your question. Just within during the discussion, a question was raised by Fatma to Nicole. She was saying it's great to have a multidisciplinary team. Do you face any challenges regarding different point of views as each one of is specialized in different area? And how do you make a final discussion if there were or decision if there were different point of views, Nicole?
Thank you. Do I face challenges? Yes, all the time. Because if you think about it, we're all experts in our own fields, so we always think that we are right. So it is good to come together as a multidisciplinary team. You have to be able to give your point of view, but you also have to give your rationale for why you feel that behavioural intervention is the most important thing, or occupational therapy is the most important thing. So that's why we do have our regular meetings. If it does come to the point that we can't agree, we would organise a meeting. It's almost like a best interest meeting for the resident, because at the end of the day, we are there for the residents. We're not there to massage our egos. We're there, what is the best for the resident? And if we can't decide as a multidisciplinary team, then we would have a neutral person come in, hear everybody's concerns, and then they would make the decision on what is best for this resident going forward.
Yeah, thank you so much, Nicole. Is there anyone have another question to our panelists? I know that within or during the discussion, lots of questions were in the chat, and our panelists, thanks to them, they were answering or typing the answers there. So please, for our audience, feel free if you would like to ask the question, like open your mic. It's okay, but just raise your hand, please. So we'll have like about, yeah, here's a question, and I guess this is from Fatma. I think Dr. Nicholas, I think he answered that, but what about answering it loud? She was asking what is the minimum and the maximum number of cases? Oh, sorry, this is for Linda, I guess. The minimum and maximum number of cases for each supervisor, and what do you think the effect of the high caseload on the supervisor and supervisee?
Yeah. So within our center, we don't have a minimum because we do have several BCBAs that don't provide supervision. For maximum, you know, it might be 1 or 2, but the absolute max, I like to set kind of a personal rule of no more than 3. And that's for kind of special cases. Maybe some of our, like the ladies within my department, we don't oversee clinical caseloads personally. So we are able to take on maybe another supervisee or 2, but I do have kind of that luxury of knowing our clinical team pretty well and all of our BCBAs, and knowing, you know, if we have some new students coming into their department, or I know they have kind of a challenging caseload this quarter, so I might cut them off even though they say they can take on more. In terms of the high caseload, I will admit that in the past, I have taken on more supervisees for a short period of time than I was able to really comfortably take on. So it was really stressful, and, you know, making sure I was traveling to some of our like partner classrooms, and it was a lot of work and a lot of time. So, you know, that's something, you know, personally, I was glad to be able to take that on. So other BCBAs didn't have to have that stress, but, you know, it's knowing what that was like and how, you know, I would never want to have that happen to one of our other supervisors.
Yeah. Thank you so much, Linda. Here's a question by, I think, Zoe to Manal. What recommendations do you have for how to empower parents, especially if we don't get much time with them? Yeah, I think yes. Okay, the mic.
Maryam, I think it depends on the parents' need. If we open the communication between us and the parents, they will start to share with us what's the most difficult situation in their home or in the community. And we will start with tiny bit, like maybe the hard time was in the car. I cannot handle it. So you will give them some tips, like what about taking maybe 3 different toys, and you give them a choice before the ride. and hide the other two. So they will be busy with that until you reach. They will learn that with time. And then they will try to take this tip or this information, and they will use it during, their flight time, during their family time. If you start with them with simple things and doable things, they will take it from you. Just try to open a little communication between you and them. Check on them. Like one of the cases in the nursery, I'm checking like every 6 weeks. It's not in a weekly basis. I'm just checking, is she taking her speech therapy sessions? How she's doing? What about her, like time, sleeping time at home? What do you think about this? We tried this one, this tip in the nursery. Did you try it at home? Just check in. With little tips, you can start. Once you gain, like their trust, they will keep coming back to you and ask for more and more. Just keep it simple, like hands-on practical tips. Keep check-in meeting, and you can share with them some videos. What I'm doing with other parents, I'm having a WhatsApp group, and the teacher, the assistant teacher, and the shadow teacher, and the parents in that group. So what I'm doing, I'm sharing videos from YouTube, something very simple and practical, depends on the issue that the parents are struggling with. And they're sharing their experience when they apply it at home, what happened to them. They can share with me even videos from home or videos from the classroom. So we keep communicating via WhatsApp. Like everybody is having their smartphones handy all day, and they can at least once a day or maybe once a week to check on that group and give you some input about what's happening with them. I found these two things very helpful with the parents. We check in calls and WhatsApp groups.
Thank you so much, Manal. Here's, I think, that will be our last question for Dr. Nicholas. Dr. Lina, she says, how do you address roles delineations across professionals when considering scopes of practice and competence when addressing content-specific goals?
It's a really challenging position to be in, particularly as a board-certified behavior analyst, because I'm supervising individuals where I have a very different, if not antithetical, clinical worldview, yet at the same time I have to create conditions for them to practice under that. So really what we ultimately do is focus on those terminal goals, those long-term goals as far as what we want to do for the client. And then in our groups, we ultimately identify, prioritize them. And through that group process, we're usually pretty good at identifying the appropriate and important skills for us to focus on. And like I said, so far, it's really produced some great outcomes.
Thank you so much, Dr. Nicholas. Yeah, 2 minutes left. At the end, I'd like to thank all of our panelists for joining us this evening and for sharing their experience with us. It was really such a great session. It was really beneficial. Thank you so much. And we have all learned a lot. So. Yeah, nice stickers you're using. So please, Dr. Michelle shared link. So see the link in the chat to get your BCB Supervision CEU, as well as a link to an evaluation survey. We would really love to hear your thoughts about this evening's panel discussion. Thank you so much again for attending ECAE's 7th Annual Autism Day, and take care. Goodbye.
Panelists, can I just get you all to smile? I want to take a photo. Thank you, everyone.